Thank you again, Trevor. Okay, now we're going to talk about the cancer microbe and AIDS. Now that you know a little bit about the cancer microbe and you know how to look for it and what it looks like in tissue, we're going to get into AIDS. And I think that of all the diseases I ever studied, the cancer microbe is easiest to find in AIDS. What causes AIDS? Well, as everybody knows, HIV causes AIDS. There's a few people, including some big prize winners, that believe that HIV does not cause AIDS, and I don't want to get into that, but if you want to look for their evidence, just Google the Perth group, and there's a lot of information on why HIV doesn't cause AIDS. I am not one of those people. I personally, I do believe that HIV is real, and it's best not to have an HIV positive test. And I do believe it causes the immunosuppression that's characteristic of AIDS. But I feel that cancer bacteria play a major role in the production of clinical AIDS. And a few people agree with me, not very many. But be that as it may, there's no question that HIV is a cancer-causing virus. Robert Gallo, who discovered the AIDS virus, has written about that. And I think it's interesting when AIDS first erupted in the United States in the gay population, that it was first called a lymphotrophic virus, and very quickly it was changed to eliminate that. And I think because the scientists did not want to give the population any cause to think that this disease was in any way related to cancer. Certainly cancer microbes have been reported in AIDS. I have done that, and I've reported it in Kaposi sarcoma. That's in the literature, and you can find those papers on PubMed. We know from Virginia Livingston's work and other cancer microbe researchers that the cancer microbe is a filtrable virus, and by that I mean there are submicroscopic forms of the cancer microbe that are virus size. Now, how that fits into virology, I think, is a good question. Obviously, there are all kinds of viruses in AIDS, as well as Kaposi sarcoma. But it may be that some of these viruses really are very, very, very tiny submicroscopic forms of the cancer microbe. It's certainly, Virginia Livingston showed that if you filter the cancer microbe, you will see smaller elements which were able to be demonstrated in 1950 using high-powered microscopes. So the fact that there are viruses all over the place may very well be compatible still with the idea of cancer microbes, smaller forms, and what have you. We know that in AIDS patients, when AIDS becomes severe, when the T cells drop drastically, that mycobacterial infection, that is TB or bird TB, which is Mycobacterium avium intracellulare, is almost universal. And again, we know that the cancer microbe, is related to the mycobacteria. So here we have, the worst immune disease you could possibly imagine, and we see that these mycobacteria, come to the fore. Now, I was studying Kaposi sarcoma before the AIDS epidemic hit in 1981. It was official in June of 1981, and I had a couple of patients. Kaposi sarcoma before AIDS, of course, was extremely rare, and most doctors had never seen a case. But as a dermatologist, once in a while, we would find a case of Kaposi sarcoma, and I studied three older Jewish men, because it's very common in Eastern European Jews, as well as Italians, and other groups, Greeks, what have you. But it was quite rare, and always curious as to whether these cancer microbes might be present in various forms of cancer. I started to take the biopsies from Kaposi sarcoma and to stain them like you would for tuberculosis, or stain them as you would for leprosy. And sure enough, you can see here in the boxes, you can see the little tiny coccoid forms, as well as these are blood cells here. So it kind of gives you a little indication there of the size of these tiny coccoid or granular forms in relationship to the red blood cells. And from this particular case, we were able to culture bacteria in the form of Streptococcus viridans. And again, I think there's no question that streptococci are basically cocci on a string. It's like take a string of pearls and you undo the string and you've got cocci. Put you string the pearls together, you got streptococci. So again, it's interesting to see if you superimpose what you grow in the lab from what you see in the tissue, that there's there's a comparison there. Now, this was one of the first cases that I came across at Kaiser, and I worked at Kaiser on Sunset Boulevard in Hollywood, where I live. And this was one of the first men to appear at the beginning of the AIDS epidemic with AIDS, and he first presented with enlarged lymph nodes. And that was a very common sign in the early days of AIDS, signifying this new so-called gay plague. And when I studied the lymph node that was removed, and the pathologist's report was nonspecific lymph node hyperplasia, which is another word for saying it's inflamed and we don't know why, you again can see in the large Russell bodies here, as well as the smaller forms within the node. So this I thought was quite interesting, because this was at a time when AIDS was a mystery disease and nobody had a clue as to what was causing it, although for some strange reason most people in science thought it was a virus, and of course the whole impetus to study this disease centered around finding a virus, not a bacterium. So needless to say, my work was still not popular. Needless to say, when that node was studied very carefully, using a variety of stains, I think some of these I forget are Giemsa stain, perhaps Gram stain, but I took a composite photographs and then chopped the pictures up and made this series of photographs, which appeared in my book, AIDS, the Mystery and the Solution, which came out in 1984, came out exactly the same time that Gallo discovered HIV. But if you look at those series of photographs, you can see how these tiny forms, they progress into these humongous size of forms, which harks back to Dr. Zalabarder's work, showing what what cell wall deficient forms of bacteria, of mycobacteria, of the TB bacteria, can look like. So I think this is, quite remarkable. And even though, as I say, pathologists will recognize Russell bodies, I really don't think they pay really much attention to them outside of the fact that I think they're rather curious. But we will show you more of this as time goes by. Now, the same gay man had a very rapid downhill course. I mean, in those days, we didn't have the cocktail, and the treatment was really ghastly, if anything. And shortly before he died, he developed some Kaposi sarcoma lesions of the skin. And here is his Kaposi sarcoma, and you can see these areas here of coccoid forms. And before he died, they finally were able to culture from his blood Streptococcus G. And again, I just show you this to show you that if you were to superimpose these cocci into these cocci, there's definitely, they look the same. It's the old expression, if it walks like a duck and quacks like a duck, and, And my feeling is, if these look like bacteria, if they stain like bacteria, if they multiply bacteria like bacteria, if they're in and out of the cells like bacteria and they kill like bacteria, duh, it's a bacteria, And you can't expect to find this sort of stringy kind of thing within the tissue, because when scientists have injected streptococci into animals, the streptococci always break up like a string of pearls would break up. And so what you're basically seeing is the coccoid form. And again, to show you, the first 5 pictures here are the German culture. And again, this culture of Streptococcus shows you that some of the cocci are tiny and some of the cocci here are a lot bigger. So when we talk about pleomorphism, I mean, certainly microbiologists would not say this is a pleomorphic organism, but my point is the size of the round forms can vary a good deal. And if you consider the streptococci in the blood at death, and you look back to the node, which was the beginning of his clinical symptoms of AIDS, you can see that the coccus is like a rose is a rose is a rose, and you can see the similarity between what you grew in the laboratory versus what you could see in the node if the node was stained other than the stain the pathologists used, because you're not going to see any of this if the pathologist, using the pathologist's routine stain. The routine stain that pathologists use is hematoxylin and eosin, and you will just not find this. Actually, it's there if you know what you're looking for, but it's very subtle. Now, here is another gay man around this, and this is all taken at the very beginning of the AIDS epidemic. Another man with AIDS-related Kaposi sarcoma, and here it's really quite subtle, and I particularly showed this picture because it is kind of subtle. I mean, if you're not going to look carefully, and you're not going to look under oil, and you're not going to stain the slide specifically to show these, you're not going to find this. And we from this case, we again grew Staphylococcus epidermidis, which is a common staph. And again, if you in your mind superimpose the little cocci, into the tissue, I think you will see the resemblance. Now, in addition, this is the same man and the same Kaposi sarcoma lesion. And again, here we also see the very large Russell bodies. Again, Russell's parasite of cancer, and here we see it in so-called, I hate the term gay cancer, but that's what everything was called. It was called the gay plague, okay? And it was called gay-related immune deficiency syndrome, or GRID, as if being gay predisposed you to a poor immune system. And then when the men died of pneumonia, it was called gay pneumonia, so everything was like geared to make it a gay disease, which is unfortunate because everybody knows that, or should know, that it's not necessarily a gay disease. But in the mind of a lot of people, it still is. And again, I just superimposed the staph here. Now, if you look closely, you might find some very tiny little Russell bodies, which, again, relate to some of these larger forms of the Staphylococcus. You can see how this gets boring and puts people to sleep because I keep showing dots. But you've got to realize that these are people. This is not tissue. These are all people, who are sick. A lot of them are now dead. And obviously it's a serious disease, and we're all looking for something to not only strengthen the immune system, which these people certainly still need, but something that will also relate to eradicating the body of cell wall deficient forms. So here is another gay man, or a bisexual man, a black man, and here we see in the center here, this is Kaposi sarcoma. We see some structures here that are called eosinophilic bodies. And these bodies were described by a few scientists who studied Kaposi sarcoma in Africa. And Kaposi sarcoma has been endemic in Africa, particularly Central Africa, for many decades. And so this is one of the rare instances where pathologists say, yes, that's something, and they call it eosinophilic bodies. But there's no indication from the pathologist that those are microbes. And here you'll see a color photograph. This is the stain that the pathologist uses. It's the hematoxylin eosin stain. And the eosinophilic refers to pink staining. You see the collagen fibers here are stained pink, and the cell's nucleus tends to stain basophilic. And here you can see how those would look to the pathologist if it was studied under oil. Now, going back to the slide past, here's that group I showed you. And here's another group of eosinophilic bodies. And we grew Staphylococcus epidermidis again. Again, we grew a coccus from this man's Kaposi sarcoma. And again, if you look at the tissue on the left and what we grew in the lab on the right, it's a no-brainer as far as I'm concerned. It's like a dead ringer. But again, nobody pays attention to this except me. So what are you going to do? Here's another case of AIDS-related Kaposi sarcoma, and you can see the tremendous numbers of coccoid forms with a TB stain and a high magnification. Now, this is like winning the California lottery. This is a patient that had AIDS-related immunoblastic B-cell sarcoma, whatever that is. Some people say it's a sarcoma, some people call it a lymphoma, but nevertheless, towards the end of his life, he developed this humongous lesion on the face, and with this rather specific type of lymphoma, sarcoma, depending on what pathologist was reading the slide. And here is like the only instance ever that I have ever come across cancer with TB like germs right in that little area there. These were like extremely, extremely rare. I guess like winning the lottery. It just, I never see that in cancer. And it's interesting because when this tumor was cultured, it grew out Mycobacterium avium intracellulare. And I think that just about anybody who's tremendously immunosuppressed is going to get TB, Even if we locked the door and we all stayed in here for months at a time, some of it's going to come down with TB just from being close. So it's like, I think one has to really pay attention to these mycobacteria, particularly in patients who are immunosuppressed. But, and this again shows, this is a photograph of the actual bird TB germ that was grown from this patient. They also grew it from his blood. And, microbiologists still complain about pleomorphic versus monomorphic and blah, blah, blah. But you can see here that this germ is pleomorphic. In other words, you have these pretty acid-fast rod stick-like forms, but in the center here, you have an area, and these are round forms. They're coccus-like. If you just took that area out, you say, oh, that's Staphylococcus. That's not TB. And it shows you, if you study the TB germ, it is pleomorphic. And it's not just the stick form that is important. Actually, the most important form of the TB germ, or of the mycobacteria, or the cancer microbe in all these diseases, is the round coccus form, which can go all the way from, I can hardly see it in the microscope, to those big giant forms that I showed you, those giant Russell bodies. That's extremely important. And when doctors look for acid-fast bacteria, they only look for the sticks. They don't look for the baseballs. And it's like you can't convince them that those little round forms are the problem. It's very frustrating. Now, going back to his immunoblastic sarcoma tumor, the little coccoid forms were very, very common. This was the slide I showed you of the actual round TB-like forms, but 99% of his germ was in the coccus form. And again, if you superimpose the coccus form, they're dead ringers. Now, the pathologist did not see those TB germs. I did because I stained the tumor like you would for tuberculosis, and I spent a lot of time looking at it, whereas the pathologist is not going to stain an immunoblastic sarcoma for bacteria because they'll tell you there aren't any bacteria there. So, again, it's the twilight zone. And well, finally, again, this again shows you the MAC, the Mycobacterium avium cellulare, in the culture, and again shows you the tumor itself. And you can also see here, this almost looks, if you just took that part of the picture out, you'd say, oh, it's the streptococcus, because that's what streptococci look like. Microbiologists love to put things in boxes where we have staph here, we have strep here, we have diphtheroids here, and we have TB here. But when you get into this stuff and you particularly read the old literature about the kind of tricks that bacteria can do, you begin to realize, gee, maybe there's some relationship between the staph and strep. Maybe there's some relationship between this strep and this TB germ. Maybe there's some relationship between these acid-fast TB germs and these non-acid-fast coccoid forms. And you start to say to yourself, what you grow in the laboratory does not necessarily equate to what these germs do in the body. After all, when you grow a germ, you're basically growing it on artificial media. There's a set formula, whereas that's what the germs have to eat in order to grow. But when you have these germs in your body, there's all kinds of stuff to eat, and there's all kinds of hormones, to deal with, and there's all kinds of stuff. So it's like trying to study an elephant at the zoo versus an elephant, in the wild. It's two entirely different things. So let me go on here. Now, I was fortunate to be able to study an autopsy of a man who died within a very short period of time. He was dead like within 2 months. And fortunately, that was a time in which pathologists were doing autopsies. After they got real nervous about HIV, they didn't want to do any autopsies because your worst nightmare is to start dissecting somebody who died of AIDS and cutting yourself. I remember one time on a friend, I was doing a biopsy on Kaposi sarcoma, and I put the needle in, and then I stuck myself with a needle. I go, oh, wow, why did I do that? So I'm still here, and I'm HIV negative, thank God. But, that's the kind of, doctors were getting pretty paranoid about, cutting into people. And so the autopsy is the ultimate cut. So, but at any rate, I learned an awful lot from this autopsy of this man. Because you can see, I don't want to, read all of this stuff, but you can see there's a tremendous amount of stuff that's happening when you die of AIDS, and this is prior to, to any good treatment. All hell breaks loose. But you notice that there are lung problems, and there's pneumonia problems, and the lymph glands are screwed up, and here's more, the heart's messed up, and hyperplasia, everything is literally gone to pot. And so I was fortunate that I was able, with the help of the pathologist, because, I hardly remembered a spleen from a kidney, but they would give me this big box of stuff, and they'd cut it up, and they'd say, well, number 4 is the heart, and number 12 is the lung, and number 14 is the, because I'm not a pathologist, I'm not a microbiologist, I'm not a virologist, I'm not an immunologist, or a biochemist. So, but anywho, the autopsy report showed that the man had a myocarditis, and so I was curious to look at the heart. And here you see within the heart muscle, you see these forms. Now, I showed you something similar to this to the man that had lymphoma who died, and his heart was, was normal. Pathology, there's no pathology in the heart. But again, it makes you wonder, how much heart disease, which is the number one killer of men and women, makes you wonder how much heart disease is involved with actual infection of the heart muscle. Now, this is the man's testicles. And again, if you look closely, you can see the cancer microbe in the testes, which is, again, relates to the concept that HIV or whatever is being spread in AIDS is being spread through body fluids. Because after all, sperm comes out, gets a little lubrication from the prostate, and that's the problem in AIDS, is the fluid transfer. Now, the lungs showed calcified granulomas and a cause unknown. And here are some strange-looking forms. And I personally, these forms get a little far out, but I personally think that these are cell wall deficient forms. They tend to produce ghost-like forms and very bizarre forms, particularly in the lung and particularly where there's calcification. Now, tomorrow, Dr. Ashi is going to be talking about this. And certainly in sarcoid, there are cell wall deficient forms that can be found in tissue that are called pleomorphic chromogens, which is a term that I don't use, but it's a term that was used by a Dr. Moscovic, Moscovic, and anyone who has sarcoidosis would do well to read Dr. Moscovic's papers, because he's convinced that cell wall deficient bacteria are involved. In fact, there's a whole pile of researchers and scientists, from the last 80 years that have written extensively about bacteria in sarcoidosis. So you really should try, if you can, to, if I can help you, I'd be happy to have some of those old papers. Probably could photocopy them, but, this idea that there are no bacteria in sarcoidosis is not based on reality, even though you will find it in the textbooks, and even though the doctors swear, no, there's no germ, but there is. It's just that either the doctors don't know the work, or they just don't pay any attention to it. But it's again, Twilight Zone science. It's there. And the fact that most doctors agree that something isn't true doesn't mean it isn't true. I mean, it's like Cantwell's law. Most doctors are wrong about most diseases most of the time. I mean, we've had 20 centuries since the time of Christ, and it's only been the past century that we paid attention to germs, because the scientific view of germs is, well, yeah, I see those germs, but they're little tiny things, and those tiny things are not going to kill a big guy like me. It's like, we knew that germs existed. We knew that germs existed for 150 years before we paid any attention to them. So, and we have, Dr. Marshall from Australia, who won the Nobel Prize for showing that ulcers are due to bacteria. Well, when I was in medical school, if you had ulcers, you had to go to a shrink, and you had to, drink scotch and milk. So, So again, it shows you that you can't go by what you read, and always by what you read in the textbooks. Trust me on this. You have to make up your own mind. Truth is only true if it's true for you. Here's the man's bone marrow, and here are probably the biggest Russell bodies I've ever seen in the bone marrow. Here, the man, when he died, had Kaposi sarcoma of the esophagus, because Kaposi sarcoma is not just on the skin. Kaposi sarcoma, you can get that internally. And here you see a wonderful collection of the parasite of cancer in Kaposi sarcoma. Here, everybody's familiar with the muscle wasting of AIDS. I mean, these people start to look like they came out of Auschwitz, at least they did prior to the AIDS cocktail. And here you see skeletal muscle, and here is a collection of these microbes. So it may be that some of these, fibromyalgias or myositis or what have you, it may be that these are basically areas of infection that go undetected. Again, none of this stuff was revealed by the pathologist because he didn't use the stain that I used. Now, when we went back to look at the initial swollen glands of this man, and again, the autopsy showed lymphatic depletion of the lymph nodes. But at any rate, we went back to see the original biopsy of the man's lymph node. Here is this, again, humongous Russell body. It's very similar to what we saw in lupus in the skin, but this is in the lymph node. So anyway, I wrote about this in 1984. It was one of the first books to come out on AIDS, called AIDS, Mystery and the Solution. And it's my feeling that obviously HIV exists, But I do think that the cancer microbe is what does the patients in. And I think if we could keep the cancer microbe level down, and by keeping it down, it means you have to improve the immune system, that I think, we would do better with AIDS, and we might be able to devise some cheaper treatments that might help the millions of people in third world countries who cannot afford, the kind of drugs that we are providing. Where did HIV come from? Well, I'm also known on Google and in the internet world as a conspiracy theorist. I can't help it, because I always want to know where things came from. And the official theory, as you know, is that HIV, and as well as KS, because 10 years after they discovered HIV, they discovered the virus that supposedly causes Kaposi sarcoma. It's a new virus. So then you have to ask yourself not only where HIV came from, but where did this epidemic of KS come from? Because here you had a rare disease, all of a sudden you got an epidemic disease in gay men in New York and San Francisco. So you have to ask, well, where did this stuff come from? Well, the experts will tell you that the germs came from Africa, and they jumped species, and they got into the monkey, they got into the human population, and somehow they ended up in Manhattan, in the gays. Well, I don't believe that. I personally believe that AIDS is a man-made disease. There's a few other health professionals that feel as I do. I feel that these viruses came out of cancer microbe research because, I mean, it's hard for me to imagine that you have all these scientists moving all this cancer stuff around between humans and animals and adapting these cancer cells to human cells, blah, blah, and not knowing that the cancer microbe exists. I mean, what the heck are we doing? So when scientists play with cancer, they're playing with something that I think, is an infectious disease. It's like playing with tuberculosis or playing with leprosy. You can get in a lot of trouble if you're not careful, and you can make a lot of damage real easily. So at any rate, I wrote 2 books, both considered in the conspiracy theory genre, explaining why I think that HIV came out of laboratory experiments. And I also included a chapter of that in my book, The Cancer Microbe. And of course, does the cancer microbe cause clinical AIDS? I mean, I think it does, but I must be the only person on the planet that does, because the whole thrust of AIDS research has always been virus, 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 virus. And it makes a lot of money for a lot of people. And I'm sure that if the bacteria in AIDS were recognized, that it probably would cause a lot of havoc, not only in the medical world, but in the pharmaceutical world. So again, I personally think that AIDS is a tremendously political disease, as well as a genocide program, as far as I'm concerned. It's covert. And of course, you have to, I think everybody agrees that AIDS is definitely sexually transmitted. The question is it a sexually transmitted form of cancer? Well, I think you have to say yes on that. If you're going to transfer HIV, and HIV is a cancer-causing virus, it's related to cancer. And of course, the big question, of course, is cancer infectious? Well, I think most scientists would say cancer is infectious, in that most scientists seem to believe that cancer is due to viruses. Certainly not bacteria, but due to viruses, and we know that viruses can spread. Is cancer contagious? Well, I don't think it's terribly contagious, but would you want to swear that cancer isn't contagious? I don't think so. Now we have a new vaccine to prevent women from getting cervical cancer from sexual activity. So, duh. But I think what happens is, medicine has made these rules and regulation. Cancer is not contagious, but at the same time, they tell you stuff that, you'd have to be brain dead not to think about that. So it's all very strange. And that's the end, and I thank you for your patience.